Okay. Now, the global report heart failure, that de novo forms almost 40%. Okay. In the prevent study, almost 2/3 were just newly diagnosed heart failure. So in de novo, you must start it right up front because it helps them get out of hospital faster, and readmissions are lower. Okay, and it helps them to live longer. Okay, next is the transition study, that shortly after hospitalization for acute decompensation. Okay, so in the here the important thing is that in de novo hospitalized heart failure reduced EF patient, the geometry of the heart, the remodeling and the reversal of the unfavorable remodeling is far better with the ARNI compared to your ACE ARB. Okay, greater number of patients, the EF increased above 50%. You can see that in yellow, 5 times more, and more than a 10 millimeter reduction in your cardiac size was also almost 8 times higher with sacubitril valsartan. So better remodeling. The high sensitivity troponin T concentration also reduces with ARNI compared to your ACE. Okay, so here that the target dose of the ARNI should be achieved by 8 to 10 weeks. Okay, and this gives a better favorable outcome. Okay, that you start sacubitril valsartan de novo heart failure along with the other molecules that are advocated, like your diuretic, your beta blocker, your aldosterone antagonist, if you now have SGLT2 inhibitor. Okay, so this early intervention is important rather than wait for disease progression. Okay, this same thing in 2021, an update for the pathway to optimize heart failure published in JACC. These are all, the ARNI is preferred as the foundation therapy. Okay, heart failure reduced EF stage 3, meaning patient is symptomatic of heart failure, has evidence by low EF or raised enzymes. Okay, so you give ARNI as the foundation therapy along with beta blocker diuretic. The other molecules, as you can see here, are add-on, whether it is aldosterone antagonist, SGLT2 inhibitor, okay, as long as EGFR is above 30. And ivabradine, if patient is in sinus rhythm, heart rate, around 90 and above, you still want it lower, then you add ivabradine. Okay. Now, all the best drugs, friends, aim that by 8 to 10 weeks, all of them are on board, and then you can gain the best benefits. Okay. Now, the ESC 2021 also advocated sacubitril valsartan as first line therapy rather than begin with a ACE in heart failure reduced EF. Okay. Here again, 2022 AHA ACC heart failure reduced EF, same thing, class 1A indication, that is what we want.